When you think about a medical emergency, you probably picture chaos, right? A lot of fast-paced, high-stress action. But what if I told you that behind the scenes, there's often a very specific script, a step-by-step guide that turns that chaos into calm, deliberate action? Well, that's exactly what we're diving into today, the protocol for one of the most dangerous emergencies in pregnancy. Okay, so let's put ourselves in the middle of the action. Imagine you're a paramedic. The radio crackles to life. You've got a call for a pregnant patient in serious distress. You're racing to the scene, and you know every single second is going to count. What's running through your mind? What's the emergency you're bracing for? Well, one of the big ones is eclampsia. This is a really serious complication of pregnancy. We're talking about dangerously high blood pressure that just spirals, and it can lead to seizures. And that seizure, that's the critical moment. It's the red alert that kicks off the entire emergency response we're about to break down. So let's really put ourselves in the shoes of that first responder. First up, we're dealing with a sudden, serious emergency. Because when things are this intense, there is absolutely no time for guesswork. The medic's actions are all guided by a super precise step-by-step plan. You can think of this protocol as the playbook for saving potentially 2 lives at once. So what's page 1 in this playbook? That brings us to section 2, gathering critical clues. Before you can even think about treatment, a medic has to become a detective, and they have to do it fast. The second they arrive on scene, their eyes are scanning for key signs. Is the patient actively seizing right now? Are they complaining about a killer headache or saying their vision is blurry? Is there really noticeable swelling, that's called edema, in their hands and face? These are the immediate, physical clues that are screaming eclampsia. Next up, they start digging for history to put those physical signs into context. They'll ask the patient, or maybe their family, things like, do you have a history of high blood pressure? Have you been going to your prenatal appointments? And a really critical one, are you more than 20 weeks pregnant, or have you just had the baby? Every single answer helps build a quick but vital medical picture. So, okay, they've got the physical signs, they've got some patient history, but seizures can be caused by a bunch of different things. How can they be so sure it's actually eclampsia and not something else entirely? Well, the answer is a cool process called a differential diagnosis. It's basically a methodical way for medics to rule out all the other possibilities. Think of it like a process of elimination, designed to zero in on the right cause. And this is what's going on inside the medic's head. Could this just be an epileptic seizure from a known condition? What if the patient's blood sugar is dangerously low, hypoglycemia? Or is it possible this is a stroke? Or maybe even a really severe infection like sepsis. By mentally checking off and ruling out these other potential causes, they can move forward with the eclampsia protocol with confidence. All right, once that diagnosis is pretty much confirmed, the protocol flips from detective mode to immediate action. Let's get into section 3, the life-saving first step. And here it is. This is the absolute #1, undeniable first priority. Before they do anything else, they have to stop the active seizure. That's the most immediate threat to both the mother and the baby, period. And the protocol gets incredibly specific here. For any patient over 40 kilograms, the max dose of the go-to medication, which is midazolam, is 10 milligrams. Not 9, not 11, 10. It's that kind of precision that makes these protocols so effective and, frankly, so safe. So why this drug? Well, think of a seizure as a kind of electrical storm going wild in the brain. A drug like midazolam acts like a super fast circuit breaker. It just interrupts all that chaotic electrical activity and brings the system back under control, stopping the seizure right in its tracks. Okay, so the first seizure is stopped. Awesome. But the danger is not over. Not by a long shot. The underlying condition is still there, which brings us to section 4. Preventing another seizure. So after stopping that immediate seizure, the whole game shifts to prevention. And the gold standard for doing that is a medication called magnesium sulfate. This is the key to stopping more seizures from happening. And this is where you can really see how adaptable these protocols are. The preferred way to give it is through an IV, that's intravenous, with 5 grams given slowly over 15 minutes. But hey, what if the medic is having a hard time getting an IV line started? No problem. The protocol has a built-in backup plan, a 10-gram dose given as 2 separate shots into the muscle. No matter what the obstacle is, there's a clear path forward. Now, with the seizures under control, the protocol moves into its final phase before they even get to the hospital. Section 5, stabilize and transport. Remember, the root cause of eclampsia is that crazy high blood pressure. So medics are watching that like a hawk. If that top number, the systolic pressure, is over 160, or the bottom number, the diastolic, is over 110, that's another huge red flag. Numbers like that actually trigger a whole separate protocol, which just shows you how these life-saving systems are all designed to work together. Beyond just blood pressure, it becomes a full-on stability checklist. They'll get that IV line in, give the patient oxygen, and hook up a cardiac monitor. They're also checking breathing and blood sugar levels. Every single one of these steps is designed to get a complete picture of what's going on and make the patient as stable as humanly possible for the ride to the hospital. And here's the final step out in the field. And it shows you how all these protocols connect. The instruction isn't just get to the nearest hospital. It's get to the most appropriate one. There's an entirely separate protocol just for that decision, making sure the patient gets to a center that has the specialized care she and her baby so urgently need. It really is a system within a system. So, what starts out as a terrifying, chaotic emergency gets completely transformed by this protocol into a series of clear, calm, life-saving steps. It's a kind of invisible system, all designed to make sure the best possible outcome happens. Which kind of leaves us with one final thought to chew on. What other invisible systems are out there keeping you safe every single day?